Hi, welcome to Fairview Range Focus. I'm Deb Boardman, the CEO at Fairview Range here in Hibbing. This is part of our monthly broadcast that we bring health information topics to our community. Today we're visiting with Dr. Sandra Hanson, our general surgeon, and Shannon Slatten, a nurse navigator at our breast center here at Fairview Range. We're discussing breast health and services and resources that we offer at Fairview Range here in Hibbing. So Dr. Hanson, let's start with you. Tell us a little bit about the current guidelines for breast cancer screening.
The American Cancer Society has determined certain screening guidelines for a variety of cancers based on studies of populations of patients and risk-benefit to the examinations. With breast specifically, the recommendation is for screening mammography to begin at age 40 and continue annually, along with clinical breast examination. They find that the young women aged 20 to 39 are best served by beginning self-examination and physician examination in 2 to 3 year intervals, frequently combined with their gynecologic evaluation.
So what are some of the risk factors for breast cancer, and what can women do to lower that risk?
Some of the risk factors for breast cancer are inherent and cannot be affected. Risk factors such as advancing age, dense breasts, family history of breast cancer, including those with the genetic mutations in the BRCA1 and BRCA2, are at high risk of developing not only one-sided breast cancer, but bilateral cancer of the breast. The duration of estrogen stimulation is also a high risk for development of breast malignancy. So periods beginning before the age of 12 and late menopause after the age of 55 puts a woman at higher risk, as does having a first child after the age of 30 and not breastfeeding. Additional risk factors include radiation to the chest wall, such as performed in patients with Hodgkin's disease between the ages of 10 and 30. The risk for the development of breast cancer begins approximately 8 years after that treatment. Some factors we can affect, and that is our diet, our exercise, and our general health. We know that obesity is associated with an increased risk of breast cancer, as is smoking and alcohol consumption in excess of a drink per day. Good health habits, including exercise, do reduce risk. In addition, avoidance of postmenopausal hormone therapy, especially that containing estrogen and progestin, helps reduce the risk.
The statistics are pretty high, are they not, in women having breast cancer at some point in their life?
The sobering detail is that it's now 1 in 7 to 1 in 8 women who will develop breast cancer during their lifetime to age 80.
How about in men?
The male breast cancer occurs in 1%, so that if we look at the studies and expect some 250,000 new breast cancers in the United States per year, you'll find approximately 2,000 in men.
Wow. So you hear a lot about breast exams. Are those self-breast exams, are those necessary?
Self-breast examination in my practice is very important. While many women will say, I just don't know what I'm feeling, I don't do it because they're just basically lumpy, bumpy, I share with them stories of ladies who have come and said, well, it's different. And I've examined them and said, no, it's not real suspicious, but they'll say, no, it's different. And I have gone on with a full evaluation and discovered a breast cancer underlying. The self-awareness of what your baseline is, the appearance of the breast, the skin color, is the nipple flatter, is there nipple discharge? These are all extremely important and may be subtle signs of the development of underlying breast malignancy. The idea is to find this disease very early when it can be cured.
So if you're doing a breast self-exam and you find a lump, what should you do next?
The best thing to do is to see your physician, your primary care provider, for an evaluation in which a complete history will be taken. A review of any imaging studies you've had will be performed, and then the clinical findings on examination evaluated. It is likely that the primary care provider will request some sort of imaging modality to evaluate the area.
Okay.
I don't want you just to ignore it or to say, maybe I'll wait 2 or 3 months and see if it goes away.
When you talk about an examining modality, is that where you're talking about a mammogram?
Imaging modality would be a mammogram, ultrasound. Less frequently we employ MRI. There is a very special advanced imaging through MRI that is available, and it's utilized only in very specific circumstances.
Okay. So you hear about screening mammograms. So what happens if you have a screening mammogram and something is found during that?
Screening mammography at Fairview Range is set up so that we have same-day radiologic interpretation. The view of the breast on digital mammography may superimpose fibrous tissue so that a density appears that is due basically to the projection of the breast at the time of exam. Therefore, with the radiologist examining the mammogram right at the time it's performed, he or she may require or ask for additional views in which the breast is rolled, the orientation is changed, or it's magnified to determine if it's real or if it's a summation shadow. If indeed there is a real density that is identified, frequently ultrasound will be performed the same day to determine if it's a cystic lesion, a solid lesion, or amenable to biopsy.
So let's take it the next step further. Let's say it's determined that it is cancer. What happens next?
The patient generally has a surgical consultation prior to the tissue biopsy. And the reason for that is that it's extremely important that there be concordance between the appearance of the lesion, the clinical findings on examination, and the findings on the pathologic examination of the specimen. So a surgical consultation is usually generated at the time that a lesion is identified as a mass or abnormal calcifications requiring biopsy. The involvement of a surgeon does not necessarily mean that the news is bad. It simply means that a physician with expertise in managing breast disease oversees so that no stone is left unturned and no false negative is allowed to escape. We want our breast cancers identified and treated. So once we have the diagnosis of breast cancer, we present to the woman her options of management. Management options include lumpectomy with radiation or mastectomy. Many times it is a personal choice for the woman. Many times it's dictated by the size and location of the tumor, and that will be determined during the surgical evaluation and consultation. At Fairview Range, we have begun to utilize simultaneous immediate reconstruction of the breast at the time of mastectomy. The benefit to that is that the approach to the mastectomy leaves much of the patient's own skin envelope so that the incision is actually tailored differently so that much of your own skin persists and allows a better contour for the reconstructed breast.
When you talk about this, I hear words like tumor and lump and lesion. Are they all the same thing?
They're roughly used synonymously, but there is a difference. A lesion is something wrong. A lump is a mass. A lump could be a cyst, it could be solid. A tumor is a neoplasm. It is a growth. It could be benign or malignant, but it is in fact a growth. We tend to interchange the terms frequently.
Okay.
Once the surgical management of the cancer is complete, the patient sees medical oncology and in the case of radiation with lumpectomy, radiation oncology specialists at Fairview, and their treatment then continues.
And those are all services available right at Fairview?
Right at Fairview.
Okay, great. So Shannon, let's talk a little bit about what a nurse navigator is.
Okay, as the nurse navigator in the breast center, I serve as a consistent point of contact for patients and for their families as they cope with a new diagnosis of breast cancer. I also work very closely with other members of our healthcare team to make sure each patient has an individualized plan of care to meet their needs. I am available with that patient when she has her first mammogram. If it's abnormal, I go along with her to her ultrasound if needed, and also into her biopsy. I also follow these patients through their appointments with surgery and oncology, just so I can serve as an extra set of ears. A lot of times women hear the news that they have breast cancer and they don't hear anything after that. So if I'm there to hear what the physicians are telling them, I can kind of reiterate to that patient after when she has questions. I also have a lot of community resources available that I can give to patients, whether it be financial needs, spiritual, medical. And I don't only work with the breast cancer patients, I'm also available to patients who just have questions on general breast health. I do self-breast exam education on patients, and I also do clinical breast exams in the breast center.
So how do patients get to you? Do they have to request that service, or are you connected to the physicians? How do they get to you?
When they come in for their screening mammogram, the mammogram techs ask a set of questions and ask them if they would like to have a clinical breast exam if they haven't already had one by their physician. And if they would like one, then I'm available. Sometimes when the patients ask the mammogram tech questions that they don't know, they'll just send them over to me, and we'll go over some booklets, some diagrams I have on healthy breasts and changes throughout our life cycle. So.
Okay. Well, let's talk a little bit about the breast center.
Sure.
What is it and what do they do?
The breast center is located in the diagnostic imaging department right at Fairview. It's a very calm, comfortable atmosphere where we offer screening mammograms, diagnostic mammograms, breast ultrasounds, breast MRIs, and we also do the breast biopsies right in the breast center. Like Dr. Hanson said, we offer the same day results. So when women come in and have their mammogram, they almost always get the results right before they leave, which kind of eases up their anxiety and worry about waiting for results. And it also allows us to take the next step and schedule additional testing that same day so that they're not waiting weeks. You know, a lot of women work, so they have to take time off of work. So if they can come in, have their mammogram, and possibly additional workup in the same day, it's very beneficial to them.
And how does a person get to the breast center? You need a referral from your physician, or can you call and make an appointment directly?
Any woman could come into our breast center for a screening mammogram. If a woman finds a lump or has some issues with her breast pain, any abnormalities that they have found, then they need their physician to refer them to the breast center.
Okay. I think it's pretty universally known that October is Breast Cancer Awareness Month, and the breast center has some special events planned. Maybe you'd like to talk about that a little bit.
Yes, we do. We have 2 evenings in October where we're going to do an open house. So October 15th and 24th from 5 to 7, we're going to offer free breast exams, self-breast exam education, free heel ultrasounds, which check for bone density. And we're also going to have evening mammograms for those 2 nights. Women will have to call to make an appointment for mammograms, but the rest is open house and they can stop in. We're going to have refreshments and some giveaways through the evening as well. So.
Okay. I know we'll be running the number later, but would you like to give people
Sure.
a number to call for an appointment?
The number for the breast center is 362-6378.
Okay. And where would it be most convenient for people to park?
The north entrance by the emergency room entrance in that parking lot. We'll have signs directing people where to go.
Okay, great. Dr. Hanson, I was thinking about something you talked about a little bit earlier. Maybe you could talk a little more about it. The BRCA 1 and 2 that you hear about and you read about now and then in magazines, could you talk a little bit more about what that is and why you would do that?
The BRCA1 and BRCA2 are gene mutations which are associated with a high risk of breast malignancy, both unilateral and the subsequent development of bilateral or disease in the other breast. In addition, there is a high association with the development of ovarian malignancy. This is a genetic mutation that is passed family to family, family member to daughter, and the BRCA2 may be carried by the male. Genetic testing, as I said, is appropriate in those patients who there has been determined to be a yield of at least 10% from the testing itself. And so it's very specific qualifications, unless you are interested in obtaining it and self-paying.
Is that something that's offered locally, or do you have to travel to that?
We do offer that. Generally, it comes through the oncology department. Dr. Pravadas has been outstanding in suggesting that patients proceed with BRCA 1 and 2 testing. And these are usually patients who have the diagnosis of breast cancer.
Okay. Well, we've gone through a lot of great information today. Anything else come to mind that you would like to add for our viewers to know today?
I think it's very important for the viewers to understand that of all patients who present with a breast lump or mass, the preponderance are benign, so that when our minds go off and racing about what I call awfulization, the reality is that the majority will be benign. And if we hold on to that thought as we go through the evaluation, it's a little calming.
Helpful, for sure. Well, I want to thank you for the great work that you do. This is obviously a very emotional thing for many women that go through this kind of an exam, especially if they do find a lump. And I know that you both do great work, and I get great compliments all the time. So thank you for the work that you do. We greatly appreciate it. Thank you both today, Dr. Hanson and Shannon, for coming on and sharing this information with our viewers. We'll be running some numbers again at the end of the show. If you have more questions, you'd like more information, just give us a call. Again, if you have another topic you'd like to hear more about, just give us a call at 362-6771, and we'll do the best we can to bring you the information you request. Thank you so much for watching today.